Good morning.
Everybody hear me in Zoom land? It looks like I'm lit up. But I think the dogs. Okay, we're good. Welcome to the March HSAC meeting. Supposed to be spring outside, but it's not, I guess. I'm glad that you were all here with us today in the room. Those that are joining us in Zoom land, just getting more. We'll go ahead and call the meeting to order at 8:30. The agenda went out. Anybody have any questions on the agenda before we approve it? No. Okay. All in favor to approve the agenda, say aye, thumbs up. Okay, sweet. Denise, you want to come and give us a treasurer's report?
Good morning. Our so far for March, our finances look like this. Starting balance was $6,068.57. We had a withdrawal. We got a gift card for our general meeting to get breakfast foods. We paid Google $24 total. So our total expense was $224. And then we had 8 memberships come in. So we had total income of $400. That left us with an ending balance of $6,244.57. We had, as of this report, 10 new memberships that had not yet been deposited. So that will be on the April report. And anything, of course, comes in after that.
So thank you all who have sent in your memberships already. If you need an invoice for your agency, let us know. Both for that reminders coming to you, whether that's when our fiscal year starts. But I appreciate everybody who has done it already, getting that taken care of. So introduction, my name is Tasha Jones. I'm the Elder Rights Specialist at Connection. I'll be your HSAC president this year. Couple updates that we are hiring for a service navigator. It is, we can work from home and the office. There is some drive time. But if you know somebody who has a passion to serve the community, to serve other adults, have them go to our website, even if you have questions. I think they're pretty awesome to work with. If you know somebody maybe just graduating, somebody wants to, just get into the human services world, it's a great program to do that. And they get a partner with all of you. I think that's all the updates of our agency.
Hello, this is Nelsie Vargas, Domestic Abuse Coordinator with Catholic Charities. I am also one of the co-chairs for the Youth and Families Committee. Just some quick updates for Catholic Charities. April is Sexual Assault Awareness Month, and we're hosting a survivor chat and put a flyer on everybody's table. We'll have 3 presenters, 3 survivors, just discuss accessing services and their experiences as a survivor within our community. Being held, hosted by our sexual assault team. So information is there, and I'll send out a virtual flyer as well. And I put on our 3 virtual support groups. If you know of anyone interested in our support groups, they're free and virtual right now. Starting in April, we'll start doing them hybrid. But anyone who identifies as a survivor or victim are welcome to join our support group.
Hi, I'm Julia Davis. I'm a community health coach at Methodist Jenny Evanson, and I have no updates at the moment.
David Murdoch, the Council Municipal Housing Agency, and I'll give an update and give the community.
Chastity Pepper with the Southwest Iowa MHDS region. And on your table, I did put some flyers to share about our crisis care services for those that are in mental health crisis. Anyone can make recently we just started the Anywhere crisis care for youth and children. So what that looks like is the crisis team will go meet the youth and the family where they're at and follow them anywhere from 5 to 7 days. And it just depends on the situation, but soon we hope to have the crisis stabilization center where they can actually go somewhere for 5 to 7 days, just as we have for our adults. But all that contact information is on the table.
Hi, Alicia Freeze, or sorry, Alicia Stoltz now, I'm not even used to it myself. And I, until Friday, worked for the Council Chamber as a Workforce Development Director. That's my only update. That position's available if you guys know anybody looking.
Good morning. I'm Brandy Waller with New Vision Homeless Services. Just a quick update. We are taking over the community shoe drive. Woo! Yes, it is a big dog. I had no clue when we took it over from 712 Initiative, what amazing job they did. But really the goal of it is to get shoes out of the landfills. And also the cool part about with New Vision's taking it over is that we're able to kind of go through the shoes and see which ones we can pull out for our house neighbors. And so we also want to open that up to any nonprofits. If you guys are in need of shoes, you can kind of come. But the big thing is if at your business or your agency, if you want to put up a box or just collect shoes, we'll be collecting them throughout the whole entire month of April. So last year they collected several thousand pairs of shoes that got kept out of landmines. And then we work with another nonprofit that will come and take the shoes from us at the end of April. So shoe drive, shoe drive, shoe drive. So we'll take those sneaky sneakers you don't know what to do with. So please think about us. We could come pick them up or you could drop them off at New Visions. And then you can also go to our social media page. There's like 32 sites throughout the city that you can also drop them off at.
Nikki Black, with Home Care Advocacy Network. I'm getting used to saying my name too. We service seniors in the homes. No real new updates, just letting everyone know we're here. We're serving all of Southwest Iowa, so we do go all the way to Monona County, basically to Missouri for covering. So letting people know that if there's somebody needing some respite or any services that would have caregivers.
Hi, I'm Sheree Stevens, and I'm the county educator with Iowa State University Extension and Outreach.
Hello, I'm Sean Miller from New Vision Homeless Services. Only new update is unfortunately Homeless Center will be closing this Friday.
Morning, everyone. I'm Adrienne Johnson. I'm the TEPR program manager over at Nanoland Housing. No new updates. Just a reminder, we do have housing office hours from 4 to 6 over at Full Circle Recovery Community Center. If anyone looking for help housing search or connecting with landlords or anyone in the community.
Good morning. My name is Jan Schnack and I am with Volunteer Iowa, the Retired Senior Volunteer Program. And this morning I thought that I would kind of talk about, we partner with Connections, Area Agency on Aging. So we look for volunteers. The volunteers that we normally, that maybe most of you might come to the Meals on Wheels. That's kind of something that a lot of people probably know about, and maybe you guys don't, and maybe I should talk about it more. But we do get people to deliver the meals to those in the community. And then what I wanted to talk about is we have a really exciting opportunity where for the caregivers, we have the stress busting for caregivers and the powerful tools for caregivers. We're looking for folks. So this is going to be kind of a little bit more of, actually meeting with the folks. And we've been doing it online, and I'm not 100% sure. I think they still do it online, but it could always go in person. But if that's something that either you or somebody that you know might like to do, we're looking for people who kind of have that empathy, with those caregivers. So you can just talk to me. We'll get you trained. So thank you.
Hello, I'm Tony Rubeck, Font County Jail, working the programs of reentry. Just here today, just like always, we're looking for a inmate program. So if anybody knows a program that they would like to come in and volunteer to teach, we're always open for ideas on that. Also, they just posting the hiring at the jail. If you guys know anybody that's young and energetic and wants a career, you can always apply. It's on the website.
Good morning. My name is Ann Christensen. I'm with the Porter County Special Advocate Program of Southwest Iowa. It's been a long time since I've been to one of these meetings, and I'm really excited to get back. I feel a lot of really unfamiliar faces, so I knew I was going to meet so many people, which is great. We're going to be having what's called a volunteer custom mixer, April 11th from 4:30 to 6.
did not think to bring a flyer, I did not realize this is what we do. So I'll remember that next time. But anyway, I wanted you to share with others if you're interested in learning more about what child advocates do for children who've been abused, neglected, or in our welfare system. We will be having a small informal gathering April 11th at Barley's in the CAP room from 4:30 to 6 o'clock at any time, or just reach out to me. Thanks.
Hi, I'm Debbie Croson. I'm with Iowa Western Community College Education to Employment. We are still working on getting lots of people into our programs. There is a welding flyer on the table for if you know anybody that is interested in that welding program. We have a new session starting up in May and then another one in September. Have them give me a call and hopefully we could cover the cost of the program for them.
My name's Sue Moran and I volunteer at Birthright in Council Bluffs. And we're always looking for volunteers also. And I put flyers on the tables. Please pick them up and post them. Or if you have someplace that you can post, we'd appreciate it. It's coming up April 26th. So hope to see some of the faces there.
Good morning, I'm Stephanie Steele with All Care Health Center. We currently go to 5 schools in the Council Bluffs Community School District. Kern Middle School, Wilson Middle School, and alternating Fridays, and then Thomas Jefferson High School, Abraham Lincoln High School, and then Canesville Learning Center. So if you want to check out that schedule, you can visit our website. We also have our regular clinics at 902 South 6th Street and here on the Lakeland campus.
Good morning, I'm Denise Parker with Family Housing Advisory Services. We provide for a lot of different housing needs, anywhere from rental assistance to financial education. I work in our home ownership program. And I just want to remind people, excuse me, we have funding to buy a home buyer's interest rate down, so we have a lower interest rate. And we can only use it in Hiawassee County, so if you have anyone you're working with that's trying to get into home ownership affordably, you can call or contact me. I can help you with that.
Good morning, my name is Sophia Sandoval. I'm from the Centro Latino. I've been here a while. Well, I have news. We launched our new website this week. We changed our logo. So I have some trifles in English because we realized that a lot of people knows that the Centro Latino is here, but they don't, a lot of people don't know what we do. So we are, I try to put as much as I could. But if there's something that one of your clients that is interested in is not in this trifle, just give us a call or send us an email and we will reply back to you guys.
I have a lot of people get to meet new people. This is the whole idea of HSAC, is coming together as a community.
Hi, my name is Jessica Hudson. I'm a prevention specialist from Heartland Family Service.
Sarah Large with the Salvation Army. We do have our personal care pantry open. We also do have 10 ride bus passes available to anyone living in Potawatomi County if they're homeless, and they can provide, like if they don't have an IOID, but they can provide like something from like Mike House, New Visions, or Together, or some agency they're working with, like stating that they're homeless here. We can get them like a 10 ride bus pass. We have updated our pantry so people can come every 30 days instead of every 60 days. We have funds for eviction prevention and utility disconnect prevention. Have them call me. We are having a spaghetti feed and silent auction on April 20th for our youth program. I thought there was a flyer. Yeah, definitely April 20th here at some time. It's the time of day. I think I want to say like 4 or 5. It's around then. I'm gonna get a flyer out from the serve that has the actual times. But if anyone has any items they would like to donate to our silent auction, they can bring them here. And come, it's like $6 for adults, $4 for $4. There's a cool flyer somewhere. I just don't- And then for any other agencies that have flyers they want shared with the listserv, if you email them to hsacinc@gmail.com, you can get those put out in the newsletter, and then they will go every.
Just a quick reminder, if you're in the room, please make sure you sign in either now or before you leave. And then those on Zoom land, just put your information in the chat so we get your attendance counted. We'll start off with Beth from Heartland.
Hi, I'm Beth Paliogas with Heartland Family Services. I am the Problem Gambling Outreach Coordinator, and you'll be hearing more about my program in a few minutes.
Hi, I'm Julie Larson. I am a prevention specialist with Heartland Family Service and the deck coordinator. Thank you.
I'm Kelly Town with Lutheran Family Services.
I'm Clarissa Newman with the Charles Lincoln campus.
Darcy Redmond with the City of Council Bluffs.
Kezia LaFavor, Iowa SNAP Outreach Coordinator with Food Bank for the Heartland.
Can anybody else not hear me in Zoom land?
Yeah, I can't. Or, well, I can now.
Hi, shall I go? Can you hear me? My name is Gail Ray, and I work with Give Recovery. It's a nonprofit that I founded to help people that need treatment for a drug addiction. And ways we help are, we help them to find a place to go to. We will also help get them there. We provide transportation to a treatment center. We'll provide help with acquiring documentation and identification that they need in order to get there. We'll work with them, you know, with whatever insurance they have. And we get them help finding halfway housing after they get completed with their residential treatment. So if they need transportation back to halfway housing, we'll help them get there. And we also help them through their first month in aftercare by taking them to places they need to get to because they usually don't have transportation. For example, when they're looking for jobs, we'll help them get to job interviews and things like that, and doctor's appointments, probation office appointments, drug testing appointments, and things like that. So if you know anybody that's in need of drug treatment and is ready to go, you can have them give Recovery a call. Thank you.
Thank you. Tammy?
Good morning. My name is Tammy Toyd. I offer Medicare plans for those under 65 that may be on Medicare disability, those turning 65, of course, and then those individuals, Medicare beneficiaries that are already on Medicare and may be looking for other plans to make sure that they're on the right one that fits their needs and their budget. I am independent insurance agent, so I'm contracted with several insurance carriers intentionally to best help those make sure that they're aligned with what their needs are. Thank you.
Carrie?
I think you said my name. I'm Carrie Hodges with All Care Health Center. I'm the Development and Marketing Director, and I have no additional updates on top of what Stephanie has said.
Thank you. Andrea? Okay, let's go
Good
to
morning,
Lisa.
everyone. I am driving. I apologize. I have a meeting out of town. I'm Andrea Edwards with Sanctuary, which is a adult shelter advocacy and housing program for survivors of human trafficking and exploitation. and I'm glad to be here. Thanks.
Drive safe. Lisa? Okay, let's go to Kendra.
Good morning. I'm Kendra Shirkey with All Care Health Center. I'm the care management supervisor, and I have no other updates.
Thank you. Jackie? Jackie, you're muted. We can't hear you.
Oh, there we go. Sorry about that. Jackie Stellish with Molina Healthcare. I did put my contact information in the chat. Just a reminder. I cover all of Western Iowa. Potawatomi is one of my biggest counties. Any kind of events that are happening in your county or nearby, feel free to send those to me. I'm the one that sends those in for consideration for like sponsorships. If there's any like tabling events, something that would be a good fit for Molina, help me find those because like I said, I've got the whole western side of the state. So whatever you've got, send them to me. Thanks.
Thank you. Eric?
Good morning, everyone. My name is Eric Webster. I'm the Director of Operations for Together. I also do not have any updates this week. This is my first meeting, so next time I will. Thank you.
Yeah, Eric, welcome to have you. Alexis?
Oh. Hi, I'm Alexis Hamilton with the West Central Community Action FADS program. I'm just here to see if there's anything I can take back to my families to help them out a little bit. So thank you.
Sarah?
Good morning. This is Sarah with Metro Housing Collaborative and Reimagine Omaha. I'm the Impact Analysis Coordinator and I run our shared housing initiative. Currently, no updates.
Let's go to other Sarah Meadows.
Good morning, Sarah Meadows with Heartland Family Service. I'm the director of our homeless prevention, diversion, and street outreach programs. And right now, if you know of anyone interested, I have a program coordinator opening for the street outreach and diversion programs.
Thank you. Shelley?
Good morning. I'm Shelley West with West Central Community Action and the FADS program. I do not have any updates today.
Lisa?
Sorry, I didn't hear. Did you say me?
I did. Thank you.
Hi. Kezia LaFavor. I'm the Iowa SNAP Outreach Coordinator at Food Bank for the Heartland. I put my information in the chat if anybody would like to connect with me about getting SNAP for your clients.
Thank you. Jonathan?
Good morning. My name is Jonathan Crossley. I am with United Way of the Midlands as their community liaison, and I'm grateful to be here. I do not have any updates.
Jeremy? Right. Well, thank you and welcome to
At this time.
Jeremy, you can introduce yourself next month though when you come. Another quick update. Our Connections is part of the Caring for Our Communities program, and we have a bed bug side committee, which is super fun. There is a flyer that is on your table. We are trying to see how much of an impact do bed bugs have in our community, how bad is a problem that we all experience from time to time. With this flyer, it's just to complete a survey. There is no money at this time. In order to ask for money, we need to present that there is actually a problem and not just frustrations. So there is, you can scan it to do it. There's also a web or a URL they can go to, or they can call our office and leave a message and we'll call them back to complete the survey. Again, this is just to kind of collect how many people are experiencing bed bugs in our community. Right now, it's just focused on Council Bluffs. But if you have somebody, we'll, collect that information too. So post it. It is, I'll share it with Sarah to get it on the listserv. We're hoping that the consumers will fill this out, not providers, unless you're filling out with the consumer. We want their feedback on if there's bed bugs, how long they've been, what services are affected because of that. Do they own the house? Do they rent the house? A lot of different factors into that. So if you have any questions, you can talk to me directly, but please share that out. All right, so going down to some old business as a reminder, kind of touched on it earlier, is about memberships. Those are due for 2024. It is $50 for the whole agency. So if you have 100 staff, it's $50. Everybody's covered to come not only to the general meeting, but also to the committees. If you have a passion for, for food, for serving the youth, for aging, transportation. Maybe you're a media guru. We are looking for people for the communications committee, lots of different places for your staff so they can be involved in the community, get to partner with all of the amazing people as well. We are still collecting those mission moments or HSAC wins. So as you're partnering with other HSAC members, let us know. We want to hear the connections that are made outside of the general meeting. So if you have a question, you're working with anybody, use the listserv. That is a great benefit. You have a question, have a concern, need a resource. That goes out to over 100 people. So you can get lots of connections. And we want to be able to recognize how we work together as a community. So if you have those, you can email into hsacinc@gmail, and then we can highlight that as well. We want to recognize all the awesomeness that you guys are doing. For the new business, I know our communications committee did send out a save the date for our Bring a Friend. That is June 26th. So if you've been wanting to bring somebody to HSAC, you can bring them anytime, but that is a big meeting. We do have a guest speaker. We have Donna Dossel from Community Foundation for Western Iowa. We normally don't ask for RSVP, but we are asking it for some of our big meetings just so we can make sure we have a head count. Even if you don't RSVP that day, you can still come. But it's just so we can make sure we have enough food and not run out or have too much food like we did last time. But that's exciting. So there is again a flyer. If you have questions, let us know. Save the date. It's going to be an awesome, awesome meeting. There was also an email that was sent to HSAC to send out to all of you. So we partnered with the Council's Library to update and kind of take over what used to be called the CB Helps. They already have a resource database. Why are we reinventing the wheel? So there was a link that was sent out just to kind of look to see what your agency information says. Does it need to be updated, new contacts, new services, services change, addresses, any of that stuff? That way we can keep that updated. We'll send that out again, share that with whatever, whoever in the agency does that, just to make sure everything is good. And if you're not on that, let's add you, because that's where we're sending people when they have questions is to that robust database there. Brigitte, do you want to come up and talk about your training?
Hello, it's me again. And so I have been a C3 verbal de-escalator trainer for about 6, 7, 8 years. I don't remember. But I've had several organizations that I have went into training. I've recently had some that reached out to me and wanted me to go and train just their organization. Unfortunately, I don't have the withstand to do it. But I do want to, I'm very passionate about this. Especially curriculum, because the thing about it is, so I always say this, so if you've been through my training, don't answer this, but how many think that in out of the last 40 years, say since the early 1980s, that we are living in the most unsafe times, the most violence, the most crimes that we have been since, let's say, just the last 40, 50 years? How many think that? So a lot of people do think that this is the most unsafe times in the United States, and it's not true. So actually the late 80s, early 90s was, but what we do have in the United States right now is, again, I side note all the time. I just went to, for Leadership Iowa for medical kind of days, we went to Eastern Iowa, and they're making a pivot from saying our mental health to brain health, which I found very, very interesting. All of them in their systems, whether it was the community health systems to the hospitals, they talked about brain health because of the mental health stigma. But all of us at some point are experiencing some sort of brain health issues, just with the amount of information that goes into our brains at all the time. And then again, when we see something like, say, a shooting in Walmart, it goes to the front of our brains. And so we say, oh, Walmart is unsafe. And then that heightens anxiety. So a lot of anxiety right now. So with this training, it really teaches you to have some tools like, how do I, number one, control my own anxiety? How do I, because again, knowing what we know, you can't really control other individuals, but you can control yourself. So this training is amazing for that. Again, working in homeless services for 20 years, I have never once been assaulted. There's a lot of tools that I've learned. And then I went to this training. I'm like, oh, well, that makes sense why it does that. And so I think everyone in HSAC's whole goal is, number one, to keep your team safe, and then keep everybody else we serve safe. And what happens a lot of times is the people we're meant to serve come in, they're having a brain health crisis. Again, if you don't have food, if you don't have safety, if you don't know where your kids are at, you are running at a high level of anxiety. And so they don't have the skills a lot of times just for us to point their finger at them and tell them to calm down. And so I always say it's a chemical issue, not a character issue. And what ends up happening is they have maybe a verbal explosion episode. And then what ends up happening is, oh, we can't handle you at our agency, you can't come back. And then the people that we are meant to serve, we actually end up putting another barrier up. So that is just a quick synopsis of it. If you are interested in it, again, the region sponsors it. The region does an amazing job. There's also other facilitators out there, so you don't have to wait till when I do the training. But I told those other agencies that I'll just do one for the community. And so if you're interested in it, it's a 6-hour training course. Again, the region sponsors it. We could do it in 2 ways. We could do it in one just 6-hour day, get it done with, or we could do it in 2 3-hour days. And so I kind of prefer that, but I also know that it's kind of hard sometimes to block out 2 separate days of the time period. So if you are interested in that, I need to know how many people before I could kind of lock down the dates and the facility. I think everybody in Council Bluffs should go through it, again, because if you do human things, which again, we've all experienced escalation. We all experienced and said things we didn't mean to when we were escalated or flooded. So I think everybody should go through it. I think everybody from, CEOs to people that are at the reception desk, everybody needs to go through this. This is an amazing tool to have on your playbook as a team of how you're going to handle situations, and not, again, just with individuals we serve, but also with each other. So if you are interested, you could get a hold of me or Maya Robinson. I have flyers on the tables. Email her so we could get a count of how many people are, and then I can start looking for venue and then time. So I'm thinking it will probably be in June sometime. By the time we get everybody who's interested, again, you don't have to wait for me. It's just, I have a lot of stories doing this for 20 years. And I was saying, you want a resume builder, work in a nonprofit for a day, So I had people that specifically asked for me to teach it. But again, the region has facilitator Sonia from Heartland Family Service. So again, just a plug, this is a very valuable tool. If you haven't been through it, make sure you go through it. Make sure your team goes through it.
Thank you, Brandy. Yes, it is very vital. We're serving individuals that are in crisis. And when we're already stressed at work, maybe our own personal life is going on, you have somebody that comes in and yelling at you, that's a lot to process. They're not yelling at you because it's you, they're yelling because it's a situation, you're just there. But I think as, providers, caregivers, that, we are that safe place, but we need to make sure we take care of ourselves. This is a very awesome training. So I would definitely take it back to your team, at least kind of talk about it. So when the dates are shared, either from Brandy's training or even look on the region's website, that way you can get your staff. We do a lot of it when we have onboarding staff, and we can kind of line it up so they can do that firsthand. Really great. Thank you. So off to the committees. So again, my name is Tasha. I'm the chair of the Aging Committee. We meet on the 3rd Friday of the month from 10:30 to 12. It is hybrid. And we meet here at Salvation Army as well as on Zoom. Just like it says, we serve, the community for the aging, very unique population. They have different needs, different, barriers than maybe a child or a young family. a lot of different, end of life, just staying independent in their home, all those different resources. So if you work with somebody who's aging, or maybe you're working with a caregiver, maybe it's a mom that is caring for her mom at home, let us know. We do have some great resources. What we're working on now is an educational sheet on quality of life. Oftentimes when we hear hospice or palliative care, we shut down because, it's usually we have a week left. No, not true. If we can get people in to hospice or palliative care a lot sooner, they can enjoy, more of their life and know the benefits. They can ride their motorcycle. They can go on vacation. A lot of different things. It's not a death sentence. So that's what our community is working on now, is to kind of change that stigma and know the resources and share the benefits to naturalize that conversation. So again, meeting on the third Friday of the month. If you have any questions, let me know. Nelsie?
Hello, everyone. My name is Nelsie Vargas. I am the co-chair of the Youth and Families Committee, along with Carrie Hurley from Family Inc. Just some updates from the committee. Sam Emerine from Raise Me to Read is leaving her position at Family Inc. So we were looking for a tech wizard, as she calls herself. But great news, we did find one. Liz Addison from Family Inc. will be our tech wizard. And then I was able to have Alicia Garcia Cruz from our program Catholic Charities be our secretary. So we have a full leadership, which is exciting because we did not have a secretary. We are still working on, so one of our goals is to support 2 community events as voted by our community members. So we are still trying to vote on the 2 community events that we will be helping with. We have the ones that we came up with is the Laundry of Love, the hygiene drive, or a meal support for that event. Catholic Charities Community Baby Shower, which is held in October. The Council Bluffs Mental Health Cares event, which will be May 23rd. And then Family Connections Mindfulness event, which is in August. So hopefully I'm hoping that next meeting will definitely vote on those. And we'll have, for our next meeting, we'll have Omar Valentine with Title I from Iowa Works present. And we are also doing a 10-minute spotlight, which Jessica Hudson from Heartland Family Services will be presenting as well. And we'll be meeting over Zoom. Any questions?
There is a real update. David, do you want to come share about housing?
David Murdoch with the Municipal Housing Agency, and we have a vibrant committee that helps people find housing, keep housing, enjoy housing. The first Tuesday, which is next week, April 2nd, we meet over here at the Charles Lincoln Foundation Building. And we will be excited. We have Scott Zimmerman from the Peer Center. He's going to be talking about just housing and what he's learned over the years, how the Peer Center has evolved into what it is today. So that's going to be an exciting topic. And then we have a tour with him in April, kind of for one of our networking events. We're going to have a tour of the Peer Center. And then we have a coffee plan for a little networking too. And we're finishing up our topics. We want to get something about those have encounters with the justice system. How do they get housed? How can we help them find housing? And that was going to be a May and June topic. I want to talk more to you even about, Tony. Be a good idea. So that's next week, first Tuesday of the month. 9 o'clock, and it's in the room or on Zoom. And Zoom has been upgraded, guaranteed to work super fast, new connection, fiber optics, and it's going to work great. So it's a good room for it. I'd rather you be in the room, but it's a great room for a hybrid meeting because we can good technology there. So I'll see you next week. And any questions, let me know.
Sarah, ready to talk about transportation?
Sarah Large, Chair of the Transportation Committee. Right now, we've been working on, we are scheduling some type of bus ridership event for June. June is like Ride Transit month-ish. It'll be like a Ride Transit week in June. They don't have an exact date yet. So we are gonna hopefully do like an amazing race type thing where we're gonna invite more like upper management HR type folks from some bigger companies in Council Bluffs to experience riding the bus and see what maybe some of their workers have to go through to get to where they have to go to get to work. And maybe that can help some of the companies be like, hey, this sucks for people. We need to help make some changes. Let's see how we can work together and make this better. So that's our goal for June. We are currently working with SWITA and some other agencies trying to come up with an alternate like transportation option for people that are not by the bus line, which is most all of our low income housing units in Council Bluffs that are not for the elderly. Like in some rural areas, SWITA helps do like taxi service, but since we're under MAPPA, we can't do that in Council Bluffs, and the stuff that Omaha offers, we can't do in Council Bluffs because it can't transfer over to Iowa and all that fun stuff. So we have an option to like lease a van from SWITA for $1. We're just trying to get around all the like insurance, safety, what all are we gonna need to be able to transport people without getting anyone in trouble. Fun stuff. And then we are trying to work on getting a car care clinic set up for the fall, hopefully out of Iowa Western, which means we're gonna talk to you again. Just remember that. And they have a great facility out there set up for teaching. And so if we can get people out there to teach them just some basic, like, here's how you check your oil. Here's how you add oil to your car. Like, here's how you change a tire. Things that we have found through just our meetings that a lot of people don't know how to do. And so that tends to be what gets them behind on like rent utilities. Like, well, I have to take my car in and spend this much money. So that's, I think, about it. We meet the third Tuesday at 9 here and then through Teams. So if you want to join us, come on down.
Thank you. Clarissa, do you want to share about the food access?
I'm Clarissa Newman. I'm the one of the co-chairs of the Food Access Committee. Last month we went to Food Bank. There were 5 of us that helped pack 1,472 pounds of food. It was a good time. Next month we are going to meet at the library. It will be a hybrid event. Right now, you guys have probably seen the flyer. We're trying to collect healthy snacks to put in the Teen Central for those kiddos after school. So that will continue through the 18th. If you guys have donations that you want to give us, all of those can be dropped off at the foundation building here on the Lakin campus. And we meet the third Thursday of every month at 1 o'clock. Some of them we're going on field trips, some of them we have hybrid. So if you guys are interested, you can just email me and I will get you the list.
Thank you. And because we're all a team here, HSAC just approved the request for the Food Access Committee for $200 for snacks. So you guys are all part of that, so thank you. That is part of the membership money that you pay. We can be able to support committees as well as agency projects. So thank you. Our disaster committee, Candy is the chair. She's not here today. They said that they have plans to share education materials and posts from emergency management, work on topics like flooding, house fires to share with the public, get people signed up for the Alert Iowa, attend and assess the preparedness fair in September. So be watching a lot of our Facebook. They're sharing that as well as our CV Helps page to be able to share with individuals how to stay safe in their home, prepare for these natural disasters. That way it's not so much of a disaster if you're a little bit more prepared for that. Then, Chastity.
Okay, Alicia Stoltz again. Chastity will be taking this over full time next week, but we are changing locations. So we meet on the second Tuesday at 10 a.m. and we are going to start meeting here. And so essentially we've kind of have been looking at a few different angles. And one of them is how do we help everybody in the community or in our committees reach our community. And so that I think that's one thing that we've struggled with recently is that we're really good at communicating with each other on what programs we have available, but then how do we help one another get that information out to the public so we can actually do what we are all passionate about. So please, 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 on your tables, there is a flyer for CB Helps, and there's a quick QR. Just go ahead and scan that QR. That is our Facebook page. And then go ahead and share that out. Please like the page and then invite at least 10 people to like the page. It is starting to grow. Also, make sure you're jumping on there and posting all of your programs so the community understands that that really is a place that they can go to find resources. It is also a place they can go to ask for assistance if they're struggling and they're not sure where to go. So feel free to keep an eye on that feed with us and reach out to anybody that has those questions or concerns or those needs, and you guys have a service that can help them. We would really appreciate that. We also are working on upping our membership this year. We want to see 70 members involved, and we are at, Chastity, what are we at now? 33? Oh, it hasn't been updated. So we are getting close, guys. So if you know anybody else that should be a part of this awesome group, let us know and we'll call them.
Remember, if they're new to HSAC, their first year is free. So it's like a trial year. Just check us out, learn how awesome we are. Be like, yeah, this is definitely worth $50 and more. So share that out with everybody. And again, anybody can join the committee. So if you have a staff member who's not able to come to the general meeting, but maybe they have a passion for another committee, have them join. If you have more questions, all that is on the HSAC website. Go to committees, all the contact information is there as well as the meeting times. That way they can get to network and share their passion with all of us as well. Quickly before our presentation, the next meeting is Wednesday, April 24th. So if you do have flyers or events that are happening before that, make sure that we have it so we can share it on the website as well as the listserv, the newsletter, to get that information out. Today we have Beth Paleokis from Heartland Family Service to talk about the gambling program. Beth, it's all you.
Thank you. Hello, everybody. Can you hear me?
Yes.
Okay. I am going to see if I can make this work real quick. And hopefully it does. There we go. Can everybody see that? Okay. So my name is Beth or Elizabeth Paleokis. I'm the IPN coordinator at Heartland Family Services, and I work in gambling addiction outreach. Heartland Family Services, we provide services to Douglas, Southwest Iowa, and Sarpy counties. And last year, we served over 58,000 people. We have a staff of almost 500, and we have more than 50 programs at Heartland Family Services. Next year, we'll have been around for 150 years, which is huge. Our problem gambling program, what we do is we identify and treat problem gambling, and we help the individual as well as the family. And we're funded by the Integrated Provider Network. Outreach is me. I'm kind of a one-man show. And then Laura Paulson does a lot of the data entry. And we also have a wonderful prevention staff too. We have great problem gambling therapists, very well trained. So we have all the services in place at Heartland Family Services to help people that have gambling addictions. So I'm going to go through these slides really quick because I know I only have a few minutes. But gambling used to look like casinos. We think of casinos or horse tracks when we think of gambling, but there are so many other ways that people can gamble. One of the largest is online gambling. It's the most prevalent right now, and it's probably the most dangerous for underage kids. You know, slot machines, scratch offs, all of those things are forms of gambling. And my bet is that most people in the room and online have at least gambled once, which is okay. We're not saying gambling's a bad thing. So some of the statistics around problem gambling, it has one of the highest rates of suicide ideation and attempts of suicide. And you can see from here some of those stats. The thing about gambling is it's really tricky because you can't see the addiction on someone. Like with alcohol or drugs or other addictions, it's very elusive. A lot of people who have gambling problems hide it very well from their loved ones and partners until they're they're at the bottom, and there's no money left. So it can really devastate a family, lead to a lot of mistrust. It's just a horrible addiction, and we usually don't get these clients through our doors until it's like their last chance. There's no plan B once they get to us. 66% of compulsive gamblers have thought about or attempted suicide. That's a high rate in addictions. Let's see. So some of the risk factors, it used to be that men were more likely to have gambling addictions, but that's not really true anymore. Women are rapidly catching up with that. Youth, it's a huge problem with online gambling and with sports betting. The average age that a child or an adolescent will start gambling is 11, 12 years old. You might not believe that, but it's very true. It can be so easily hidden from parents because most of us older parents aren't as tech savvy as kids. So they know where to go. They know how to use technology to online game, online bet. So it's becoming a huge problem, and the laws have not caught up to uh, internet. So, this is one of the things that we're seeing a lot of in the schools. I think most of these would be very common sense to most of you. Extreme behaviors, they increase over time. Thinking about gambling, even when you're not doing it, finding ways to get money, borrowing money, missing work. Those are things that you'll see. Lying to loved ones, mood swings, thoughts of suicide. Again, a very high suicide rate. It's just really scary. And then one of the things about gambling is most of the people that come in that we see that have gambling addiction have a co-occurring addiction with it. It's very rare that you just see gambling. It's going to be something with alcohol, drug use, a mood disorder. There's a high amount of, I believe it's 38% of problem gamblers that come in and they have PTSD. So these are things that when we get a client in our agency for a substance abuse or alcohol or any addiction problem, that usually comes to light after they've started in therapy. And the 15 to 20% have attempted suicide. That's huge. That's really huge for addictions. I want to go back just for a second. One of the things with sports betting that concerns us is that usually starts in middle and high school. And they found that the higher risk for mental health and substance use problems compared with other kinds of gamblers, 14% of sports bettors report thoughts of suicide, and 10% say that they have attempted suicide. And we're talking about high school kids. And then, of course, the outcomes of problem gambling, financial, there's debt, homelessness. We see that a lot. Emotionals, depression, suicide, social, family, vocational, physical health, legal issues. 50% of problem gamblers have committed a crime because of their gambling. That's a high number. We will see some of these clients in the courtroom when we go to mental health court and work with the system. Barriers to seeking help shame, denial of the problem. Again, there's a lot of shame around uh, a gambling addiction. They've lost friends, family members, divorces. They're embarrassed. They're not facing up to what's really happening. They're not aware of resources, and there's that stigma associated with services, especially if it's a particular culture that doesn't really believe in therapy. And then the cost is a big concern. But at Heartland Family Services, we have a huge grant. And so what we do is we charge based on a sliding fee. And if a client is in heavy debt because of gambling, and that's usually the case, we also look at that debt when we're establishing the fee. The first 2 sessions are free. We do have outpatient individual therapy and group therapy, and our therapists are trained in gambling addiction. And there's also free uh, therapy for the family members and or significant others that they can participate in, and and couple counseling. We have additional assistance in transportation reimbursement through the grant, so that they can get to and from therapy, court, even their jobs. So that's a nice little bonus with our funding that we have. And then if you know of anybody that has a gambling addiction or a family member that's struggling with that, they can call 1-800-BETS-OFF or Heartland Family Services and get immediate help. If they call 1-800-BETS-OFF, they will send them to probably us or the nearest organization that treats problem gambling. Any questions? That was very fast.
I don't see any hands up in the room here, Beth. Thank you so much for that information. And it's crazy to think of, when you think of gambling, you think of the casinos, that's a big thing, but how gambling is part of everyday life. Especially around gift time. I know my mom always gave us scratch off tickets for Christmas. And having, my kids were younger, they always thought it was the coolest thing. Like, hey, you got scratch off tickets because they win. And you kind of instill that so early. Because who doesn't want to be a winner? Only one more time, one more dollar, one more something.
No, I agree. Yeah. Yeah, it's definitely a problem. I like tutor in the evenings at a mathnasium, and one of the prizes the kids can win, and they just place this in the box is scratch offs. I'm like, oh my God, did they really? So yeah, I think all of us do things. And it's not to say that gambling is bad. Look, my husband works in a casino. Okay. I used to work in a casino. I don't think it's the devil, but when people have a problem with it, they need to be able to reach out for help. And it is an addiction. So there's not a lot of studies behind it yet. There's not a lot of research. What they do have is good research, though. But we're going to see a lot more problems in the next 10 years, and we're going to see it with young kids, especially college students too. That's a higher risk. So thank you you guys for giving me your time. I have a horrible cold, and I was afraid I'd start sneezing.
Well, thank you again. And just in closing, remember that the next meeting again is April 24th. There are lots of flyers on your table. Those that are in Zoom land, we will make sure those are shared out to you as well. And if you have any upcoming events, any flyers, send them our way. We can get them out to everybody, and enjoy the rest of your day and your week.